What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, June 22nd, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Why do we do the daily pandemic update? Well, let's read this post on X from David Lingenfilter. Why? Because it really describes what we try to bring awareness of every day. And it starts off by saying in bold print, you've been lied to. COVID didn't go away. COVID is not a cold, a flu, or mild. And let's face it, a lot of people are trying to tell you, oh, COVID, that's over with. No, it's not over with. It is still a thing. An infection increases risk of heart attack by 40%, even in young people. That's why you read news about younger than usual heart attacks. Each infection damages your body even if you don't know it. Each infection can cause brain damage. Each reinfection damages your body more and increases risk of long COVID. Long COVID is the second phase of COVID that causes lasting illness. 90% of those with long COVID started with mild COVID. The vaccines reduce risk but doesn't fully prevent COVID or long COVID. Wear a respirator or mask to avoid COVID and long COVID, like an N95. Those not masking will likely have long COVID within a few years. And let's face it, a lot of people who do not take COVID seriously have had it multiple times at this point. Wanted to start off today by reading that. So if you're new here, want to know what's going on with the pandemic or other viruses, because you just heard, hey, it's not over with, and we prove that to you every day. Subscribe down below, give this a thumbs up, hit that notification bell, share this with anyone you know, leave a comment down below. All right, starting off with this today. H5N1 bird flu found at 8 more dairy farms, including 6 in Colorado and 2 in Iowa. All right, moving on to BioBot now. And I thought I would show you BioBot just to give you another perspective of what's going on with COVID right now, and then I'm going to show yet another one after this because there is very conflicting news and information right now. And it says here, COVID-19. In good news, wastewater data show that COVID-19 activity and community viral load slightly declined in week 24. The national average sewage wastewater concentration is now 330 copies. And if you look really close here, it does show that there was a slight drop. However, there's another perspective that came out last night. And check this out. Jay Weiland posted an update for June 21st saying that there are larger increases now. 16% increase this week. Western and southern states with the highest rates. KP.3 variant plays a significant part of increases in the West. He's saying 250,000 new infections per day right now. 1 in every 134 people currently infected, 2.1 times lower than the 12-month average. So again, you can see here, he's saying things are continuing to rise and rising a bit faster. BioBot says there was a brief drop. So at this point, I'm going to correct something I said yesterday. I don't think there is a drop, and quite frankly, when we take a look at CDC data, it's showing the increases now in pretty much every state for epidemic status. And when we look at the national hospitalizations, they are rising as well at this point. I want to show you something else that he is showing. And he shows the regional breakdown better describes the situation. The West is about 3 times higher than the Midwest and Northeast. The South is a little more than double the Midwest and Northeast. So right now it's the West and the South that are really seeing the rises. The Northeast, the Great Lakes, as we know, oftentimes is the case with these summer waves. The West and South rise first, then eventually the Northeast and Great Lakes eventually rise as well. And we are seeing rises in New York State. So it's not like they're not rising. They're just not rising as fast right now. Part of the reason could be Northeast did get hit really hard with the winter wave. The West didn't get hit as bad, so that could be part of the reason. Ratio of people currently infected by region. Midwest, 1 in 182. South, 1 in 97. Northeast, 1 in 224, and the West is 1 in 61. Yeah, the West is really bad right now. All right, moving on to this now from the UK, and quite frankly, yet again, something confusing. The UK, this is a news article from The Independent. They're not the only ones. I've seen several people post this on Twitter and several news articles stating that the UK is currently seeing a 24% increase week over week in admissions. I honestly don't know where that data is coming from. Here's the UK's dashboard. Here's what I have for people admitted to the hospital. Yeah, there was a little increase, but that was as of May 29th. Are they using that data? I honestly just do not know, because this seems, it says here, up to and including 29th May 2024. If anyone has any answers for me, or if this is what they're showing, let me know down below. All right, moving on now to a poll that I did last night. I kind of put it out really late. In fact, we should probably retweet this, right? So it gets some more attention. Let's do that. This is a poll I did last night. Have you encountered delays with healthcare as of lately? Could be anything from a doctor's office to a specialist being booked months in advance. And take a look at this. 88.5% of people so far said yes. 11.5% said no. That's only out of 165 votes. We just did a retweet, so we'll see if it gets more attention as the day goes on. If it does, I will give you an update on that again tomorrow. Someone put here, no appointment scheduled for in 2023 for 2025. Nothing sooner for first-time patient. Wow, this is down in Georgia. Nothing sooner than 2025? That is absolutely ridiculous. So they schedule in 2023, and they can't have this done until 2025. Wow, that is just totally ridiculous. That should not even be a thing. All right, taking a look here at the national allergy map. Drum roll, please. 44% of the country is in low to medium status today. We can see it is high again in Oregon with red. Also high to medium in portions of the Four Corners region. Not bad in the southeast. Not bad in New England today. Nor is it that bad in the upper Midwest. Moving on to air qualities. All right, air qualities, they're not great whatsoever. Hopefully it does come up. If not, I can just tell you what's going on. In the east and southeast, we are continuing to see bad air qualities. Why? With this heat, underneath this heat ridge, there are really, look at this, here we go. This is really this is really the worst section in the United States right now. Aside from California, you can see here, really bad air qualities in the mid-Atlantic, northeast, up to about Boston. North of there is a little bit better, but not that much. And as I expand this westward, you can see here, it does get a little bit better in the plains. And then California has its usual hotspots. You can see here, there's some yellows in California today. Taking a look now at this, and this is something that I do want to show you. I have another place where I talk about climate and weather, and that is Climate Data Report. You really do want to follow this channel, or this X page, especially if you live in the Northeast. Already, I posted a tweet about a tornado warning just a little bit ago up in the Northeast. The bigger threat is tomorrow, and I am really concerned about that. Also, we did post on our other channel today about severe weather and heat that's going to be coming for the month of July. Yes, July is looking to be extremely hot across much of the United States. All right, back to our health segments now. Taking a look at this. EMS calls in Philadelphia yesterday, 840. Yeah, that's not a number we're happy with. Again, it's to be expected, and when we take a look here at what's going on right now, we should probably still see some heat exhaustion calls. Yep, right now in Montgomery County, Pennsylvania, there's a heat exhaustion call, respiratory calls, and taking a look at what's going on in Chester County, I assume we'll see some here as well. Yep, heat exposure, respiratory difficulty, heart problems, all things that you would expect to see on a hot day. Luckily, it doesn't look like it's terribly busy right now. Looks like, though there are calls for heat-related illness, it doesn't look to be extremely busy. That is a good thing. Moving on now. Walgreens this week. National positivity rate continued up. So you can see here, there was no drop here as well. I don't know why I said that yesterday. I shouldn't have, but we'll just have to wait and see what happens. There's various different methods of data. You got wastewater scan, you have the CDC data, and then you have Biobot data. So there's 3 different ways of getting wastewater. It can get confusing at times when some of them show something different, but this, taking positivity rates from COVID tests, which is what they do at Walgreens, you can see here, national positivity rate continues to steadily climb. It's at 30% this week. It went up by 2.9%. All right, let's take a look at some CDC data now. We'll take a look at some hospitalization data, and we can see across the United States here, Yeah, hospitalization admissions, or ER visits, I should say. These are for ER visits for people positive with COVID. They continue to go upward, and you can see we are now approaching, let's see, what is our current number? 0.71%. Probably will go at or over 1% during some point of this wave. Taking a look at what's going on with California. California continues to rise. We can only hope California peaks pretty soon. Taking a look at what's going on with Hawaii, and you can see here they are continuing to be the highest level in the country at this point. Hopefully we see a peak there soon where they start to drop. 7-day moving average here is, wow, 5.15%. That is a really high and unacceptable number. Even if people are not going there because they have COVID, or because not, whatever the case may be, that's a lot of infection that is going around in hospitals in Hawaii right now. And when there's that many people showing up positive, the chances of hospital acquired infection does go up, because remember, masking doesn't always occur in hospitals these days. All right, moving on now. Let's take a look at epidemic status for COVID. And check this out. It's likely growing in a lot of places. It's growing, likely growing. It's not declining anywhere. It's stable in a few places, but it's not declining anywhere at this point. It is now stable in Hawaii, so we can hope that means maybe things are finally hitting the top of the rise and maybe going to finally start dropping soon. One can only hope. Epidemic status is growing in Maine, Vermont, Massachusetts, Rhode Island, New Jersey, Maryland, West Virginia, North Carolina, South Carolina, Florida, Mississippi, Arkansas, Louisiana, Indiana, Illinois, Wisconsin, Michigan, New Mexico, Arizona, California, Oregon, and the state of Washington. It is likely growing at this time in the state of New Hampshire, Pennsylvania, Delaware, Kentucky, Georgia, Alabama, Texas, Kansas, Nebraska, South Dakota, Minnesota, Colorado, Idaho, Wyoming, and Montana. And again, it's stable or uncertain in Alaska, Hawaii, where else? Looks like Connecticut, Iowa, and North Dakota. And then, yes, Nevada as well, Utah, also in Oklahoma, also in Tennessee. It's not reported in Missouri or New York at this time. So, yes, it is rising in a lot of places. We're clearly in the summer wave at this point. And as we see in the data here, let's move over to the next piece of data. We can see KP.3 is the reason for that at 33.1%. Though KP.3 has only been the lead for a couple weeks now, KP.2 drops a little bit. It's at 20.8%. LB.1 is really starting to pick up the pace. And I'm reading some news stories stating LB.1 could be set to overtake KP.3 in a few weeks. How insane is that? So KP.2 took over back in, when was it? End of April, early May, I forget. Then just a couple weeks later, KP.3 took over, and now already we have LB.1 lined up, and who knows, before this summer's over, at the rate we're going here, something else will probably come into the pipeline. It is absolutely insanity to see all these variants popping up so fast. I mean, it is absolutely crazy. Did 2022 have variants popping up this fast? I remember for a while there, after the initial Omicron, we were really going with the variants, but here we are once again. These variants just keep evolving. This is why you need these updates, because you need to be on top of what's happening. Each variant has different characteristics. Some are similar to the past. Some can spread faster than others. And it looks like LB.1 is set to spread pretty quickly because it's really starting to rise up the charts here. You can see here how fast, in the brown on the left, how fast LB.1 is really starting to pick up the pace. All right, New Jersey today. Surprise, surprise, 65 out of 70 hospitals reported on a Saturday. 220 hospitalizations, 7 people on a ventilator, 19 people in the ICU, and discharge of stay in New Jersey is at 42. New York State, their hospitalizations, let's refresh this, hopefully we do get something. Their hospitalizations and their cases, it continues to rise. And we can see here, 1,404 cases on Friday. Their numbers, they continue to rise because we're in the summer wave now. Northeast has not really picked up the pace yet, but despite that, New York State is, it's on a slow and steady rise. And I would say that rise probably went up a little bit faster this week. Hospitalized patients, 673, and in the ICU 42 at this time. Alrighty, folks, tomorrow we will do the Sunday wastewater update. We'll take a look at a wastewater scan. We'll take a look at what's going on with the CDC. Unfortunately, we'll probably see some conflicting data, but what we will see on the CDC wastewater page tomorrow is that there are more red and orange sites, and I can actually show you that real quickly right now. Going back to the CDC wastewater surveillance page, you can see here the numbers of orange and red sites. They did go upward. We'll individually take a look at a few of them tomorrow, and of course, any news that pops up tomorrow. If you like this update, give it a thumbs up. Want to see more updates like this? Subscribe to my channel down below. It is the best way to stay informed with what is going on with these viruses. Some people give me the comments saying, well, you talk about COVID, but you don't talk about flu. Alright, right now, regular flu is not being a big deal. We are talking about bird flu, and I should show you this. I didn't show this today. I forgot to show this. H5N1 in wastewater here. I believe this is influenza type A. Let me correct myself. Here's influenza type A. You can see here. It has increased in Illinois at this time, and it's been in the high to above average category for a few weeks, and it continues to be. Look at this. Oregon is also in the above average category at this time. So, I mean, it is out there, but right now our main focus is, of course, bird flu and the summer wave of COVID. We'll talk about RSV. We'll talk about regular influenza when the time warrants it. When we start seeing it going up in wastewater, of course we're going to mention on it. But right now we have to focus on what is actively the biggest issue at the moment, and that is COVID, and of course the evolving situation with H5N1. Alrighty, folks, I will see you all again tomorrow. Give this a thumbs up, subscribe down below, hit that notification bell, share these videos with anyone you know, and leave your comments down below. Thanks for watching, and have a fantastic Saturday evening.